Hi everyone, it's Kelly from the Hub. I am here with Stacy, our master stroke person who knows everything in the entire universe. That's what I like to say. How are you?
I'm good. How are you today?
Good. Remember that Stacy works for WellSpan, and she is the stroke coordinator. So she teaches people about how to prevent stroke, and she also teaches people who have had a stroke how to do stuff after and sort of get better. So today we are talking about how to prevent stroke.
How to not have a stroke.
Okay, this sounds like a big topic. Let's tackle it.
Okay. So the fancy term for this is talking about risk reduction, but that sounds fancy and very boring. And I'm not going to lie, this isn't a really exciting topic, but it is really important. So I want people to know that there's two things with risk reduction with having stroke. One is there's a bunch of things that you can't do anything about. Race. So race by stroke by race, as far as how high of a risk you are just by your race, is Native Americans, then Hispanics, then Blacks, then Caucasians, and then Asians, okay? So there's that, and there's nothing you can do about that. Now, even though I put Caucasians pretty low down there, we need to talk about those of us that are Pennsylvania Dutch. So my last name is Ettinger, and yes, that's about as German as you can get. And so I also have the lovely Pennsylvania Dutch figure. So please do as I say, not as I do. So those of us in Lancaster County, even though we're Caucasian, have a much higher risk of stroke than in other places where the population's all white. We've intermarried for religion for 400 years, and we basically have been passing these genes back and forth to each other. The other thing is that if you're young, men are more likely to have a stroke than women, but after 65, it's all us. So women are twice as likely to have a stroke and die from one than to have breast cancer. And we all know somebody with breast cancer, everybody. It has to do with our vessel size and the fact that we live so long and a whole bunch of other things. That's really pretty much it. There's some odd diseases that you can have. And of course, if you have those diseases, but they're pretty rare. So we just want to stick with the regular stuff. So one of the things we see now in the ER more common is people in their 50s, their middle 50s having strokes, and it's almost always men. And I don't know if I don't think it relates to this. I think this is just those men, those age are having more of the other risk factors, but I need to talk about what the most common risk factor for stroke between the ages of 45 and 65. So I'm 54, so I'm right in the middle of that. So the biggest risk factor is drinking. So if a man drinks more than 2 drinks a day, or a woman drinks more than 1 drink a day, the risk for stroke is higher than if they were diabetic and smoking at the same time.
Really?
Yes. So has been a lot over the years about drinking's good for you and wine's good for you and everything. And they're really starting to back off on that a little bit, which I'm really grateful for. Before I did this with stroke, I was an open heart ICU nurse, and we used to see people who drank quite a lot all the time. So it really isn't good for your heart. If you want to get that, it's called resveratrol, which is the thing that's good in it. They have it in supplement form or non-alcoholic wine, but alcohol itself causes a whole lot of problems. The second most thing that you could do is diabetes. We just talked about diabetes. We'll slip that in here, is to take really good care of your diabetes. So I know that Mira from the Wellness Center has talked about diabetes on the Hub, and she has told you that basically those little sugar crystals, when they're dissolved at at the very, very base level are still crystalline, meaning they're sharp everywhere. So they basically cause all these little slices on the inside of your vessels, and then those slices get filled with platelets and cholesterol and fat and dead cells, and they make themselves a nice big fat clot. Yeesh. Smoking does the same thing actually, except for it does it with chemicals instead of doing it with sugar. The chemicals that are in cigarettes are very acidic, and they cause little like chemical burns all inside your vessels. And the same thing happens. The tissue is open, and trash and fat and cholesterol and everything gets sucked up on the side of that, and you also have a stroke from that. High blood pressure, we went over that last week. I cannot, because not only can that cause problems as far as bleeds, it can also cause problems as far as ischemic stroke, because your blood pressures, your vessels get smaller and smaller and smaller. So the closer that they get together, and blood pressure is tough. You know, it's really tough. You really need to go to a doctor, and you need to keep on it, and you can't just ignore it if you have no symptoms. It's ever present. You just need to keep on it if you have problems with your blood pressure. Lack of exercise, I don't like it either. Nobody likes it. That's something I'm struggling with myself right now, trying to get ready to do something about that. It's a process. You got to go through it with your mind. I think you just have to find something that you like more than you hate, or you hate less. How's that?
And
Let's be real.
You also have to find somebody that will help you and motivate
you in the butt.
Right, whether it's your pal, whether it's your kid, whether it's your spouse, whoever it is. Like for me, if I had our friend at WellSpan who does this all the time, if she stopped over every morning and said, come on, let's go, I'd do it. But without her.
Yeah, you have to reach. It's a test of fortitude.
It is.
Because you have to reach so deep inside of yourself. So we all know that. We all know that. So those are in what you eat. Although I'm going to tell you right now, because this is the big thing I'm going to talk about, is cholesterol. Is that cholesterol really is much more about your genetics. People can be very, very rigid, healthy eaters and only eat everything they can, they should, and they still have high cholesterol. And then there's people who eat every horrible thing that comes along and they have great cholesterol. So you really need to know that and go to see your doctor. Cholesterol is, the two things we give people when they get discharged from the hospital across the board after they've had a stroke, and it sounds like it's no big deal, but trust me, it is a big, big deal, is aspirin or an anticoagulant and statin, some type of a statin. So
what's a statin? Because I think everybody knows that, like, taking a baby aspirin or whatever dose you're supposed to have is the thing that is like the miracle cure that's so super easy. So that'll help. What's a statin?
So statin is, the name statin is named for the class of the drug. And what the drug does is it lowers your cholesterol. At least that's what everybody thinks it does. And it does do that, but it does a whole bunch more. It is so good for your vessels, it's not even funny. And it's so important and does so many different things that if you've had a stroke, we don't care what your cholesterol is. We want you to stay on that statin for the rest of your life. That and whatever, either an aspirin or Plavix, or if you have to be on an anticoagulant, I hope you don't, but if you do, you do. And that's the real world. But statins do a whole much more. The first thing that they do, and I always talk about this in girly terms because I'm used to teaching nurses, is they make the inside of your vessels nice and smooth. It's like anti-aging cream for the inside of your vessels. It keeps your vessels, it keeps your vessels from cracking
so all
or getting
those
all those
nasty
little
cuts.
Yes.
Yeah, that will get in there, it smooths them so nothing can stick.
Right. It helps out a big time. It really does. They also reduce inflammation. So the inflammation that they reduce, you hear that about all the time. That also helps from all those little things from cracking and pulling and everything. They release laughing gas into your blood, and that laughing gas makes your vessels a little bit larger. They keep your cells from rusting and becoming trash that's just sitting around waiting to make clots inside your vessels. They prevent, people have, also older people, not the young kids, but the older people have heard the term hardening of the arteries. And hardening of the arteries really isn't about cholesterol, it's about calcium. For years, we thought that we couldn't do anything about this, so nobody really talked about it. But when you're elderly, you have a lot of calcium lining in the sides of your vessels, and if you would touch it, it would feel like a glass light bulb. So obviously, that's not an ideal state for your vessels. So, but statins prevent that. So what have I talked about? I've talked about rusting. I've talked about the fact that they keep your vessels nice and pliant. I've talked about inflammation. I've talked about lowering cholesterol. Oh, and triglycerides. So especially for somebody who's a diabetic or has a higher blood sugar or is really a carb fiend, they help lower your triglycerides. So there really isn't much better that you could do for your vessels than take a statin. Now, there's lots of different statins out there. There must be, I'm counting the ones that I know in the United States that are like common ones. And right now, off the top of my head, I'm counting 7. I'm sure all over the world, there's probably more than that. People, you know, there's all different kinds. And what each kind has tried to do is it's tried to make one that has less side effects. So people don't like to take statins because they say they have a lot of different things. They say, well, can I take brewer's yeast? They want to do the all natural thing. Well, brewer's yeast will bring your cholesterol down, but it will not do all of those other things that we're talking about. So it's really not a great option. It's only for people that really, really, really can't take statins, and those people are very, very rare. So what I hear, in Lancaster County, people are very hardworking, and there's a lot of arthritis. So what I hear is people saying things like, I took my cholesterol medicine, my statin, and it caused me to have pain in my finger. That is not from the statin. Statins cause muscle pain, not joint pain. So if you're having pain in your knees or pain in your fingers or pain in your elbow, that is not caused from the statin. That is indeed your arthritis. However, if you are having all of a sudden, after some time, not 3 days afterwards, but weeks afterwards, starting to have some pain in your buttocks or your back or your thighs, the large muscle groups of your body, that could be from your statin. But guess what? Guess what we can do? We can change your statin, and you may not have those symptoms. There's so many available, and everybody reacts differently to them. The one that is popular right now and was a lot of money for a lot of years and no longer is, it's finally been, it's been generic and cheap for about, I'm going to say 3 years now, is Crestor or Rosuvastatin. And that reason that was such a hot ticket for so long and they continue to make money off of it is because out of all of them, it causes the least muscle aches and pains. And, you know, most people don't really have what I'm talking about. They're looking at their daily normal aches and pains and their arthritis, and they think that it's caused from the statin, and that's just not the case. Statins are also cheap drugs. I'm a big fan of the Walmart $4 list. I was a social worker before I became a nurse, and I think like that still. So there are very popular statins, Lipitor particularly. That one decreases your triglycerides quite a bit in addition to doing all the things we talked about. And that is on the $4 list at Walmart. So that's a good one to know. But please, I think I said this last time and I'll say it again. People assume that if they're on a drug and it doesn't go well, that that's it. It's just done. You're just over it. And that is indeed not the case. There's so many different statins. There's so many different blood pressure drugs that you can switch them around and have good health after that.
I have to tell you, I've said this every single time, and I will say it again. I learn stuff every single time we chat. Who knew all those things about statin? It's like we should write a song about them.
I know. I said someday when I'm retired, or hopefully before that, if I had song making skills, I would write a song about them.
Let's do this. Let's challenge our fellow community members. If you would like to write a song,
yes,
ode to statins, you've got a place to show it. I'm sure the hospital would love a little video as well.
Yes, please. That would make me so excited.
I'm putting it out into the universe because people need to know how cool a statin is.
That's right.
Most people think you take one because the doctor said, and you don't really know why. You just take it. Now we know all the things that it does.
Mm-hmm. It's an amazing drug.
Yeah, it is an amazing drug. Stacy, as always, thank you very much. You are a godsend to the stroke universe. And next week, we'll talk about something else that people need to know.
Okay, that'd be great. I'm looking forward to it. And I'm going to put in one plug right now. I know everybody's over COVID. We're all tired and everything. Nobody wants to wear a mask. It's hot out there, and a lot of people think that it's infringing on their rights or whatever. But right now in Ephrata, we're seeing a huge spike in COVID cases. The hospital is full of them. The national news, several studies are showing now, that's separate from the news, the studies are showing that COVID is now going into places where there's smaller population. So please, whether or not it's cool or not or whatever, please start wearing your masks again. It's really bad news.
Thank you very much. Thank you, Stacy. We will talk again soon.
All right, thank you.
See you, my friend.